Hello everyone, welcome to the channel. This will be a pathology video, the first in the series in ischemic heart diseases on the topic terms and basic etiopathogenesis by Dr. C.S.B.R. Prasad, Professor of Pathology, Sri Devaraja's Medical College.
Hello students, today we are going to deal with ischemic heart disease where myocardial damage occurs due to hypoxia or ischemia. So before going into the actual topic, as usual, we will be reviewing some of the terminologies that we are going to use in this lecture. Ischemia and hypoxia is the first one. So hypoxia refers to decreased oxygen concentration in the blood, whereas ischemia refers to decreased delivery of oxygen, decreased delivery of nutrients due to narrowing of the vascular channel. And infarction and necrosis. Infarction is the grossly appreciable changes in a dead tissue, whereas necrosis, that is microscopically appreciable tissue changes in a dead tissue. And myocardial infarction refers to the death of myocardium due to hypoxia or anoxic damage. And what is the critical value for hemoglobin, and what is the basis for this critical value? Critical value refers to any value, biochemical value, wherein if you don't act immediately, the patient may have some complications. And with respect to hemoglobin, it is set as 7, and below 7 there is going to be some detrimental changes that can occur to the patient, and you should act immediately in order to heighten the levels of hemoglobin in these patients. So what is the basis? In a healthy individual with a normal coronaries, if the hemoglobin drops below 7, there will be anoxic damage to the subendocardial area. So subendocardium is supposed to be the highly prone for stress and strain because of the myocardial activity or cardiac activity, and any drop in hemoglobin below 7 is associated with appreciable damage to the subendocardium. So the hemoglobin concentration set as 7 as a critical for the patients. So susceptibility of different tissue for ischemia. So ischemic susceptibility varies from tissue to tissue. If you look at the CNS, 5 minutes is the maximum tolerable limit, and if you look at the myocardium, it is 20 to 40 minutes, and if you look at the skeletal muscle, more than 40-50 minutes, and if you look at the fibroblasts, probably they can survive for hours without any nutrient supply or oxygen supply. So effect of ischemia on a cell. So if you recollect the general pathology, when there is ischemia, there is low ATP production. Low ATP production is associated with the inability for the sodium potassium pump to be active, and because of this there is increased permeability. Sodium enters the cell, potassium leaves the cell, and there will be entry of water into the cell swells, and if it is for a longer duration, cell membrane gets damaged and its cell becomes leaky and it may die too. And what is the reperfusion injury? So when you establish circulation into a tissue which is already anoxically damaged or dead, there is going to be some changes which can be detrimental for the survival of the lightly damaged tissue which is surrounding this infarcted area. So this is known as reperfusion injury, and there are many mechanisms which we will be dealing with that. So what is the end product of anaerobic metabolism? Probably if you look at your physiology, end product of anaerobic metabolism is lactic acid. So whenever there is anaerobiasis, you will see the cell pH dropping, and because of this increased concentration of lactic acid. So what is the effect of lactic acid accumulation within the cell, or drop in pH within a cell? So it is associated with, again, the dissociation of the ribosomes from the rough endoplasmic reticulum, and there is a decreased protein synthesis. Okay, let us go into the actual topic, but before that I will show you some of the slides which we already discussed. So difference between ischemia and hypoxia. Note the oxygen tension and delivery of substrates in this table. So oxygen tension is normal in a ischemic area, whereas the hypoxia, it is low, and delivery of substances is decreased in ischemia, whereas delivery of substances is maintained hypoxia. It is due to the normal patency or normal diameter that is maintained in the hypoxic area. Ischemia injures the tissue faster than hypoxia because this delivery of substrates is less in the ischemic mechanisms. And effect of ischemia on the cell, I told you, drop in ATP, and this failure of sodium potassium pump, influx of sodium and water into the cell, efflux of the potassium, and the drop in ATP is associated with anaerobic glycolysis and drop in cellular pH, which is associated again with the drop in lipid and protein synthesis. So ischemic reperfusion injury, I told you, because of when you re-establish circulation, the high concentrations of calcium and increased recruitment of inflammatory cells with associated release of reactive oxygen species and blunted antioxidant defense mechanisms because already damaged or dead tissue as IHD, and it is in reference to the myocardial ischemia, and any imbalance between the supply and demand of oxygenated blood or nutrient supply to the heart is associated with ischemic damage to the heart muscle. And most of the cases of ischemic heart disease are due to the narrowing of coronary arteries. So IHD is almost always equated with coronary arterial disease, but in the true sense, coronary artery disease constitutes only 90% of the ischemic heart diseases, and the 10% may have other causes for ischemic heart disease like arteritis or syphilitic aortitis, or it may be thromboembolic manifestations which are entering into the coronaries, which are normal and causing ischemic damage. In most of the cases, it is slowly progressive and with late manifestations. And ischemic heart disease, there are identifiable clinical syndromes. They are 4 in number. One is the angina pectoris, wherein there is no damage or death of the myocardial tissue, but there is ischemic damage that occurs frequently, especially when the person is subjected for exercise. And chronic ischemic heart disease, wherein there is slowly progressive damage to the tissue, myocardial tissue, which is associated with small areas of necrosis and replacement of this necrosed area with fibrosis, and later on the patient usually comes with heart failure rather than ischemic heart disease, typical ischemic heart disease manifestations. And cardiac infarction, myocardial infarction, is the important clinical syndrome associated with ischemic heart disease, and this is the most common thing also. And this myocardial infarction is associated with death of myocardium. So they just compare angina pectoris, there is no death to the myocardial tissue, whereas myocardial infarction is associated with death of myocardial tissue. And sudden cardiac death without any prodrome, without any clinical symptoms, the patient can die due to some cardiac problems. So if you look at the epidemiology, it is the leading cause of death in males and females in US and Europe or white population or developed countries. In our country, this incidence of cardiac diseases are on the rising trend. Okay, decline in deaths in males and females in the Western countries is due to altering the modifiable risk factors, and the better diagnosis and treatment are available, and hence there is decline in death rate due to ischemic heart disease in Western population. And if you look at the risk factors for ischemic heart disease, they are same as atherosclerosis. Probably you have genetic test susceptibility, you have the hypercholesterolemias, you have sex or hormones which are associated with offering some protective nature. And for coming to pathogenesis of ischemic heart disease, diminished coronary perfusion relative to myocardial demand. I told you that the supply and demand is imbalanced. Because of this, the myocardium suffers from ischemic damage. Why myocardium suffers from ischemic damage? It is due to fixed atherosclerotic narrowing of epicardial coronary arteries. So there is narrowing of epicardial coronary arteries due to atherosclerosis, or probably disrupted atherosclerotic plaque causing ulceration or release of its contents, or when it is ulcerated it may cause thrombosis at that area, further narrowing and causing ischemic damage. Or intraluminal thrombus. Intraluminal thrombosis, probably the patient, say for example a patient is having ventricular atrial fibrillation because of slow contractile movements. Because of this defective contraction of atria in atrial fibrillation, the patient may the blood may stagnate in atria, and it is associated with thrombus formation. So such thrombi can get detached and enter into systemic circulation, causing even the coronary arterial narrowing. Platelet aggregation and vasospasm is another thing. Probably atherosclerotic plaque may rupture, and when it is ulcerated or ruptured, platelet aggregation occurs, and platelet aggregation activation results in release of varieties of cytokines or chemicals which are associated with vasospasm locally. So it can cause, platelet activation can cause coronary vasospasm, and syphilitic aortitis can cause narrowing of the coronary ostia and causing probably ischemic heart disease. So if the coronaries are narrowed to 75%, the patient may not have ischemia at rest, but when there is exertion or exercise, it may precipitate ischemia or cardiac pain. And when the coronaries are stenosed to 90%, the patient suffers from ischemic pain even at rest. So there may be single, two, or all three coronary arteries may be involved in this ischemic heart disease. So most notably left anterior descending, left circumflex, or right coronary artery. So these are the coronary arteries. You can see that right coronary artery giving rise to right marginal branch, left coronary artery giving rise to anterior descending branch, and also circumflex branch. So pathogenesis, it may be due to acute atherosclerotic plaque changes, it may be due to inflammation, or it may be due to coronary thrombus formation, or vasoconstriction, as I was explaining, due to platelet activation, or it may be due to vasculitis, which narrows the coronary vascular channels, causing ischemic damage.
Thanks for watching. Do subscribe to this channel.